short topic, but it is very valuable topic. So antihistaminic, histamine is an inflammatory mediator, and it's a neurotransmitter of CNS. It can be found in high concentration in mast cell of basophils and as well as the enterochromaffin cells of GIT. So if you see, you have a different tautomers of histamine. One is known as pros tautomer. This is the pros tautomers, and if the bond is shifting over here, the tautomers is known as teletautomer. Okay, so this is pros tautomer and that is teletautomer. So tau, it's given by the tau. So histamine is very stable in tau tautomer. The teletautomers are more the stable one. One thing you must remember that histamine also can be projected in a Newman's projection formula. Okay, so if you refer to our earlier video in stereochemistry, please refer that so that you can have a better understanding. Over here it is a gauche configuration, we have seen that, and if it is opposite to each other, then it become anti-periplanar. So anti-periplanar is very good for H1 and H2 receptor interaction, but gauche isomer is valuable for interacting with H1 receptor, right? So histamine can be dissolved in water, ethanol, but not in ether. Decarboxylation of histidine gives histamine. Hypothalamus and enterochromaffin cell is a source of histamine, and histamine released from the mast cell, which is IgE mediated. It's very important to understand that IgE regulate the release of histamine, that is type 1 hypersensitivity reaction. Now histamine receptors are G protein coupled receptor, H1 responsible for wakefulness, body temperature regulation, nociception, allergy, bronchoconstriction, vasodilation, and the cough. Okay, H2 receptor antagonist. So what is the action of histamine on H2 receptor? It stimulates H plus release from stomach and increase the libido, where H3 receptor is autoreceptor, releases histamine, noradrenaline, and serotonin. It also involved in the lipid metabolism, the H3 receptor. Okay, and H4 is responsible for chemotaxis. Now coming to the first antihistaminic, which is H1 antagonist over here, which I have given. The first H1 antagonist I have written this acrivastine, which is one of the important antihistaminic. Why it is so important? Because acrivastine can be used to treat hay fever, allergic rhinitis, and it is contraindicated in pregnancy and geriatric patient. But the thing is, it is the dosage frequency very high, 3 tablets per day. But if you consider the loratadine or desloratadine, normally inverse agonists of H1 receptor are levocetirizine, desloratadine, and pyrilamine. Okay, these three are very useful in the market, but still loratadine also used in the market, which is dosage frequency is 1 tablet per day. But unlike acrivastine, it is 3 tablets per day. Then you have ebastine. The ebastine is used to treat urticaria and rhinitis. It do not cross blood-brain barrier, and it produces very good cardiac safety. No QT prolongation can be seen. Okay. Then after that you have loratadine, which is also used rhinitis and hives and hay fever. Okay, but it can cross the blood-brain barrier, and it once upon a time it combined with pseudoephedrine, but now it is banned, pseudoephedrine. Okay, and why it is banned we'll discuss in our hypertensive class, antihypertensive agent. It is contraindicated also in a hepatic disease, not to be given in the pregnant woman. Then you have a cetirizine, which is significantly cross blood-brain barrier and produce drowsiness, and it has a similar function with chlorpheniramine maleate, whose side effect is tachycardia and drowsiness. And it's also used to treat rhinitis, dermatitis, and urticaria. But for good treatment of allergy, this drug is much more preferred, fexofenadine. Okay, the brand name of fexofenadine is Allegra. Sometimes it is combined with montelukast, which is 5-HT69 leukotriene receptor antagonist. Now fexofenadine, it is a third generation antihistaminic. but the very good antihistaminic is bepotastine, which can be used to treat ophthalmic allergy, pruritus, okay, itching and urticaria. Okay, now coming to the H2 antagonist, which is known as famously ulcer agent. It can be used to control peptic ulcer, Zollinger-Ellison syndrome. You can refer to our smart class of gastric GIT disorders. Okay, then H2, the first is cimetidine, where this structure is common. This structure is known as cimetidine, having the side effect of normally gynecomastia, loss of libido, so it is no longer used in the market. But ranitidine, okay, it is used in the market, and you must be knowing that the Rantac and Zintac, the famous brand name, once upon a time GPAT they have asked. Ranitidine also given in the IV form, intravenous form. The toxic trace of ranitidine is known as N-nitrosodium methylamine. It is that toxic carcinogenic substance. That's why it was withdrawn for certain time in the market. Side effect is vertigo, tachycardia, hepatitis, risk of pneumonia. One thing that the very good drug ranitidine also required vitamin B12 supplement if it is given for prolonged time. So that's why it has to be given in a combination with vitamin B12. Then famotidine also used for Zollinger-Ellison syndrome, but prolonged syndromes, the side effect it's QT prolongation. Then after that you have a nizatidine, almost the similar structure, which is used to treat GERD disease, but the side effect is muscle twitching, headache. Okay, and much more. Nowadays it is used as a anti-ulcer agents or to control